Hello, my dear patients. This is Dr. Asu from Istanbul. I'm a board-certified plastic surgeon. Today we're going to talk about the breast lifting procedures. I'm telling the procedures. Why? Because we have 3 different type of breast lifting technique. Totally according to the size of our patients and the size of your breasts and the skin sagginess, how much skin excess you have, and the nipple position. Very important thing is the nipple areola position of your breast tissue. Our patients are mostly seeking for a plastic surgeon because of the after pregnancy change on the breast tissue. What happens when you get pregnant and when you have breastfeeded, when you have multiple kids? There's of course skin issues. There is skin sagginess and stretch marks on the breast tissue, and the nipple position goes down. They start, before they were looking just forward, and now they are looking for the ground. So what we do, basically we can divide it 3 sessions. One is, the first, we can put an implant. If your breast tissue was very small, maybe you have the small breast tissue before, and after the surgery it's like a balloon, then it's empty. Then you don't have any more breast tissue inside of the breast. So with an implant, we can achieve like up to 3 to 4 millimeter lifting with a basic implant. We can decide it according to your 3D simulation, which I apply you during our consultation. It takes like half an hour, and we can decide which size and which shape of the implant best for you. And what is the second choice? Our second choice could be, if you have a little bit more severe nipple areolar sagging problem, we can put an implant, and after we can elevate the nipple position with a surgical technique. We basically, like a tailor, we cut the excess skin below the nipple areolar position, and we elevate the nipple areolar position with an upgrade position. So of course we decided according to your measurements, like every millimeter is so important for us, for you and for me. And what is our third option? The third option is, without an implant, we can just lift your breast with the surgical technique. Our surgical technique can be only a lollipop shape, or an inverted T shape, or G or L shape. It depends on totally your skin excess and skin sagginess and nipple areolar complex sagginess problem. And how is the after surgery? After surgery is very similar like breast implant and breast reduction surgery. At the end of the surgery, after 2 hours, you will be able to go back to your normal life in the hospital. You will be able to walk, you will take your meal, and at the end of the day, you can go back to your house. At the house, on the 3rd day, first 3 days, you have to be a little bit relaxing position. But you can go outside, take for a walk, and after walking, you can go home and rest. And you can take care of your babies at the end of 3rd day. Please, for the first 3 days, get some help from your family, from your husband, if you have little kids. After 3 days, you can take shower. We finish our controls, and then you can cook, you can do some daily routine works, and after the 5th days you can go back to your job, and you can go to airplane if you are having the surgery in another country, like my patients do so a lot like this, and you can take an airplane, go back to your country, and go back to your more social life. But the first month is very important about the sport activities, and you shouldn't take like heavy things like more than 10 kg. And what about the scar management? The scar management is, I advise you some creams which you're gonna start after 10th day of the surgery. We don't have any stitches. The stitches all are inside, they are hidden. We don't remove any stitches from your skin. We just apply some creams and some special tapes to reduce the scar tissue, which takes like 3 to 4 months. But the all scar healing takes, we can say, according to your skin type, according to your genetics, many things. If you have any extra disease like diabetes, blood pressure problem, or any systemic illness, some diseases, it depends on your all the conditions, but we can say like 6 months to 1 year. The all scar healing is day by day getting better and better. We use some creams and we apply some tapes to reduce the scar. And the other question coming from my patients, what if I get pregnant again after the surgeries, after the breast surgeries? I always say to my patients, this is a life condition. After you had an implant, you can have breastfeed, you can have babies, you can do everything. But if you get weight like more than 10 or 15 kg, of course you will have a deformation in your body, because we are getting older, our body is aging, our collagen is reducing in amounts, so we have to take care of our body. As a lady, we are unlucky than men, because we always should take care of our body. We always try to be healthy. We always try to eat healthy. The daily sportive activities should be always in a part of our lives. So we should be always focused on our bodies. Please, if you had a breast surgery, you can get pregnant again. You can breastfeed your baby, but you should take care of your body. You shouldn't gain weight like more than 10 or 15.